Standing Committee on Appropriations has highlighted that most medical malpractice claims arise from negligence in maternity wards. Chairperson Mmusi Maimane is conducting an oversight visit at the Chris Hani Baragwanath Hospital in Soweto. This hospital has the second highest number of medical claims amongst healthcare facilities nationwide. And Newzroom Afrika's Veronica Makhoali has more.
While South Africa is grappling with an explosion of litigation on medical claims, and we're here at the Baragwanath Hospital in Soweto to an oversight visit, essentially, and to get more details and understanding of how Parliament plans to stem this and also prevent provincial coffers from running dry. I am joined by the Chairperson of the Appropriation Department. Dade, thank you so much for your time. I think first and foremost, walk us through what exactly we will be doing here today.
Well, I think as part of the committee, we want to make sure that we give the best health care to the citizen in this country. And if medical legal claims are ensuring that money is not being allocated to citizens, it then becomes important for the committee to come here. And at our starting point, we met with representation from Labour to be able to get an understanding of what if the 2 billion rands budget that's allocated to Baragwanath, 64% of it is spent on Labour. We need to understand what the issues there are. What are some of the contributing factors when you look at questions around whether there's on-sale of information so that medical legal claims are increased? How do we ensure that there's staff shortages where you find certain doctors, doctor-patient ratios are high, ensuring that there isn't always quality of healthcare. So that's on one component. The other aspect is to look at the legal component, and so we'll meet with the management of the hospital to understand how do they deal with some of the legal issues? Because at the end of the day, when you've got budgets that are coming in and you're spending a lot of your money settling claims, Baragwanath is second highest in terms of medical legal claims, and therefore it becomes something that we need to attend to so that we ensure that money that is being spent settling claims should have gone to staff improvement, should have gone to infrastructural build, etc. And then we'll be going around on site to understand the three vulnerable areas, which are obstetrics and gynecology, looking at surgical sections, and then looking at issues of nursing so that we can be clear that ultimately is the quality of healthcare improving and that we can ensure that we avoid cases of malpractice that leads to medical legal claims.
Yeah. And that is my next question, the cases. We know that Gauteng and the Eastern Cape are among those that have some of the highest claims that we've seen, and we're hearing you now say that Chris Hani Baragwanath Hospital is one of the ones that are definitely in the red. When we talk about the cases, for those that are at home and are really battling to understand what does this entail, what are just some of those cases that we're looking at when we talk about some of these medical malpractice claims?
Yeah. So you often find, for example, at first level, there was a syndicate that was targeting the Department of Health and found some vulnerabilities. Your biggest point of vulnerability, why this matter occurs quite significantly in places like gynecology and obstetrics, is because at the starvation of a child at birth through lack of oxygen, etc., they may have other long-term complications. Not all claims are illegal. Some of them are legitimate claims. Of course, in a sometimes context where there's overcrowding, etc., mistakes are bound to happen. And therefore, there needs to be just compensation for that. But where you can prevent mistakes from happening by making sure there's enough doctor-patient ratios, by making sure that the infrastructure works, that when there's load shedding, that the appropriate generators kick in so that things work and continue to work, so that you don't have an environment upon which things can become chaotic, this becomes absolutely crucial that we fix for that. So when we see these claims come through, part of what we do as a committee is to try and understand what are the preventative measures we can do? And then also, I agree perhaps maybe with the Minister of Health in saying, rather than it being always a litigious question, let's always go to court. How do we ensure that we can settle these claims effectively, quickly, in a way that doesn't have to involve courts because our courts are already clogged up? Let's ensure that we can adjudicate quickly and make sure there's compensation, particularly for victims of malpractice in any way.
Thank you very much for your time there. Speaking, of course, to the chairperson of the Appropriations Committee, Mmusi Maimane, speaking about the fact that there is a far more proactive approach now in regards to dealing with those malpractice claims that are bleeding out provincial health departments across the country, claims amounting to almost 100 billion, in fact. And, of course, we'll be keeping up with the developments on how this hospital specifically plans to tackle that. For Newzroom Afrika on Channel 405, I'm Veronica Makhoali in Johannesburg.